I think the QUINTESSENTIAL-2 is a very important study because it compare a novel CAR T targeting GPRC5D and not a BCMA like the current approved CAR T for relapsed refractory myeloma. And this is a randomized open-label multi-center phase 3 study comparing arlo-cel, CAR T against GPRC5D, to standard of care, which can be daratumumab, pomalidomide, and dexamethasone, or carfilzomib and dexamethasone by the investigator choice. It's a randomization of 1 by 1, and the inclusion criteria is adult patients with myeloma who received 1 to 3 prior lines of therapy and were exposed to lenalidomide with a measurable disease and an echo performance status of 0 or 1. And we know that previous data from studies with the arlo-cel showing that this CAR T is very, very efficient in myeloma, very active with response rates of about 95%. Many of them are a complete response, and the safety looks also quite encouraging, with very rare severe CRS or severe ICANS. The side effect that we are very familiar from the anti-GPRC5D bispecific antibody in the mouth, in the throat, in the nails, in the skin, are an issue here also, but the magnitude of that is really decreased, and many patients have this side effect, but to a lesser degree, and it's very reversible because you give the CAR T only once. There is the issue of cerebellar toxicity that is not completely understood and can be an issue with this CAR T, but overall there were really less than a handful of cases like this. So I think this study is very important, and enrollment to this study is very competitive in a lot of sites in the world because it's a very attractive study. It's about to enroll about 440 patients, and we are eagerly waiting for results to be reported in future meetings.